The elbow complex consists of 3 bones and 2 joints. The humeral ulnar joint and the humeral radial joint form the elbow. The motions of flexion and extension of the elbow provide a mean to adjust the overall functional length of the upper limb. This mechanism is used for many important activities such as feeding, reaching, throwing, or personal hygiene.
The humerus is the proximal bone within the elbow complex, and it has attachment points for the brachialis muscle and the medial head of the triceps brachii. And the primary features are going to include the trochlea, which is going to articulate primarily with the trochlear notch of the ulna, the capitulum, which is then going to articulate with the radial head, the medial epicondyle, which protrudes further out, and it's going to serve as an attachment point for the medial collateral ligament and most of the forearm pronator and wrist flexor muscles. And the lateral epicondyle, which will not stick out as far as the medial epicondyle, and it serves as attachment point for the lateral collateral ligament as well as the forearm supinator and wrist extensor muscles.
So as you can see here, these are the primary surfaces that partake in the articulation between the humerus, radius, and ulna.
And then for the ulna, it is going to be, it's the medial but distal arm or bone of the elbow complex, and its primary features are going to include
the posterior view of the proximal end of the ulna has the olecranon process. This is a roughened posterior surface that accepts the insertion of the triceps brachii. It is commonly what we feel when we palpate our elbow. On the anterior side, there is the trochlear notch, which articulates with the trochlea of the humerus. In addition to this, there is the coronoid process, which is that anterior small projection that can be seen here.
So the radius is going to be also another distal bone in the elbow complex, and it's going to be more lateral to the ulna. And the primary features are going to include the head, which is that top ring, the neck, which is just inferior to the head, and the radial tuberosity, which that all will offer, it's all a structurally small component to the elbow. And when fully supinated, it's going to be parallel and lateral to the ulna. So now we're going to go ahead and look at the ligaments of the elbow. The first one is going to be the medial collateral ligament, which is going to provide resistance against the valgus or abduction forces on the elbow, and it will provide articular stability throughout the sagittal plane of movement, and it's typically susceptible to injury when the elbow is fully extended and violently forced into valgus. And it consists of the anterior portion, which is the strongest and stiffest, the posterior portion, which becomes taut in extremes of elbow flexion and is less defined than the anterior fibers, and the transverse fibers, which provide only limited articular stability. And onto the lateral collateral ligament, it will provide resistance against varus forces, and it will split into 2 fiber bundles. The first one is the radial collateral ligament, the RCL, and the lateral ulnar collateral ligament, and these fibers are pulled taut in full flexion of the elbow, and they provide frontal and horizontal plane stability at the elbow.
Now we're going to talk about the muscles that contribute to the function and the actions of the elbow.
Alright, so the biceps brachii has a long head and a short head. Its main function is to flex the forearm against heavy loads or flex it quickly. The brachialis also flexes the forearm and is active in all positions since it only crosses one joint. It is considered the workhorse of the elbow flexors and for low loads and low speeds, the brachialis is the prime mover. The brachioradialis does assist in forearm flexion, but its primary role is stability rather than mobility. The pronator teres, flexor carpi ulnaris, and flexor carpi radialis are not true forearm flexors, but they all may assist in the beginnings of forearm flexion. Compared to the forearm flexors, there are only 2 forearm extensors. The triceps brachii is the prime agonist for heavy loads and fast speeds. It also has a lateral, medial, and long head. The inconius is a very small muscle near the elbow joint, is activated during low load and low speed movements. It also stabilizes the elbow during supination and pronation.
So the motion of the elbow has 1 degree of freedom, and we're going to talk about extension and flexion. During flexion and extension at the elbow, motion occurs within the sagittal plane with a medial and lateral axis. Flexion is the motion of bringing the forearm closer towards the humerus, while extension is the motion of bringing the forearm farther away from the humerus. At the humeral ulnar joint, there is a sliding motion of the trochlear notch of the ulna on the trochlea of the humerus. During extension, the trochlear notch rolls and glides posteriorly, and during flexion, the trochlear notch rolls and glides anteriorly. At the humeral radial joint, there is a sliding motion of the radial head of the radius over the capitulum of the humerus. During extension, there is little to no contact at that joint, and during flexion, the radius rolls over the capitulum.
The elbow joint and its ability to move is due to the innervation from 4 different nerves. The anterior proximal muscles that aid in flexion of the elbow are innervated by the musculocutaneous nerve. The nerve branches off the brachial plexus from the lateral cord and has contributions from C5 to C7. The musculocutaneous nerve innervates the biceps brachii, coracobrachialis, and brachialis. The posterior arm is innervated by the radial nerve. In regards to movement at the elbow joint, the radial nerve innervates the tricep brachii and anconeus, which extend the elbow. The radial nerve innervates the brachioradialis, which flexes the elbow. It also innervates all the muscles of the posterior forearm. The extensor carpi radialis is the only one of these muscles that assist in extension of the elbow. The median nerve innervations of the elbow joint are to muscles that assist in flexion of the joint. The pronator teres and flexor carpi radialis contribute to elbow flexion, but it is not their primary action. The ulnar nerve is the last of the innervations for actions of the elbow joint. While it innervates other muscles, the only one contributing to elbow flexion is the flexor carpi ulnaris. And that is the elbow joint.